Okay, hopefully that's working again. And, okay, where were we? Hyponatremia, yeah. Does that make sense? Yeah, it makes sense because we're diluted, okay? And therefore, it seems like you have less because that's all we can really do is we can stick a needle in your bloodstream, draw that blood out. Dilutionally speaking, we know that there's a lot more water than sodium, okay? So it's diluted, so it looks like hyponatremia on a lab test, okay? What else we got here? All right, continuing on with our testing, okay? You have decreased serum osmolarity, okay, same reason, it's diluted, and increased urine osmolarity. Does that one make sense? Because too much total body water should lead to more urine, right? If you got too much water in here, you should be urinating it out like crazy. That's not exactly how it's working though. Okay, why is that not working like that? Well, think about this. You have a whole bunch of water in here. Remember our little diagram a while back where we were looking at it? And we said the whole thing started because the heart sensed, or the vascular system sensed that there was too much pressure in the blood. Okay, the same thing here. You got a lot of water, ton of water, so that you're intoxicated with water inside your blood. And if you have that much water in your blood, you bet your blood pressure is going to be really high. Well, if your blood pressure is really high, that's going to do the same thing as the ANP and BNP did, and it's going to suppress your renin. Well, if you suppress your renin, it's going to make it so that you have suppressed renin. What did that do? That made you urinate more. Okay? Well, yeah, it made you urinate more, which means that you have a lot of stuff left in your urine. Okay? So that part is true. So you got a lot of stuff in your urine, but you don't have a lot of stuff in your cells. Makes total sense, right? Okay. Maybe maybe you can do a CT or an MRI to look at maybe there's a tumor. That's another way to test to see maybe there's a tumor in the brain or in the kidney or wherever that might be. Okay. All right, moving on to potassium. Okay, what do we know about potassium? Again, that's one of our little ions that has a positive charge. We know, well, it's somewhere 3.5 to 5. I say somewhere around 4 usually is your typical how much you're going to find, again, inside your bloodstream. Okay? And it's the one major one inside the cell, not outside. Okay? Okay, so it's doing the same kind of thing, right? It is going to, the function is going to be the same as opposite of sodium. Maintains the intracellular fluid osmotic balance because you're pulling water in for that. It also does glucose and glycogen deposition. Okay, so that's a little bit different. I guess we really haven't talked about that before. Glucose, glycogen, sugar, okay, is just being stored in your liver and skeletal muscle, and that has a lot to do with potassium also. Okay. We already know about transmission of nerve pulses because when we had our action potential, right, and we had the sodium going up on this part, and then we had something coming back down, well, this part, on this part of it over here, is the potassium, where the sodium was the part over here, right? So that sodium is going up, potassium is coming down on the other end of it, so it still has to do with transmission of nerve impulses, just on the other side of it, okay? Maintenance of normal cardiac rhythms, again for the same reason, skeletal and smooth muscle contractions, okay, same reason. What do we got about organs and hormones involved, okay? What deals with it? Of course, the kidney does. Remember in the kidney how aldosterone, for example, okay? would take the sodium into the bloodstream, and then it would kick a potassium out every time it did. Okay, so that's one of the things, and of course the kidney is always maintaining every electrolyte anyway. Okay, so what happens if we get too much or too little of potassium? Okay, first off, again, hypo, not enough, emia in your blood, K, not enough K, right? Not enough potassium, hypokalemia in your blood. Okay, don't have enough. Less than 3.5, more than 5.5 is too much. And let's talk about the causes. So you could have reduced or inadequate intake of potassium. Okay, who gets those kind of things? Well, maybe the elderly again. Anorexia, of course, if you're not eating enough. That's true of a lot of things. And alcoholism has a very unique relationship with potassium and not getting enough of it. Okay? Increased entry of potassium into the cells, of course. We'll talk about alkalosis and acidosis in the next video. But let's just say that potassium is very much involved in the whole alkalosis acidosis thing, and we'll get back to that, okay, later. Okay, of course you can lose body potassium by things like diarrhea, vomiting, nasogastric suction, whatever. If you increase your aldosterone, again, increasing aldosterone is going to bring your sodium back in, but it's going to kick potassium out. Okay, and of course diuretics, same thing, it'll increase your aldosterone too. Okay, so what are your signs and symptoms? Okay, muscle weakness and cramps, arrhythmias, shallow T wave. That kind of makes sense, right? Because again, if it's the downside of that action potential, then you're still not going to get that full depolarization, repolarization thing going on without the potassium. So you're going to be weak, you're going to cramp up. Your arrhythmias, or shallow T wave, okay, when you're looking at the EKG, EKG is what? You got a P, Q, R, S, and T wave. None of that group, there it is. Wow, that took a while. Okay, this part is your potassium right here on that T wave. So if you don't have enough, you're just going to get a shallow T wave. Right? It's going to be really little. That kind of makes sense? Sure it does. Okay, that is actually lining up with the EKG is, of course, lining up with this whole action potential thing also. Okay, so if this part of it's potassium, that part is still potassium. Okay, that's what lines up on the EKG, where the sodium is a different part. All right, let's look at why would you have too much potassium. Okay, well, duh, you took too much of it in. You had a whole bunch of potassium salt. Who the heck overdoses on potassium salt? Well, lately a lot of people, because now we have those waters, those natural waters that have no sodium, right? Well, again, like I did earlier, many people just use sodium and salt synonymously. Okay, potassium is a salt. Okay, so we think no sodium means no salt, but in reality, they chock those things full of potassium. Okay, so you're drinking all this water with no sodium in it, thinking, hey, awesome, I'm not being bloated and whatever, but you're drinking a ton of potassium. Okay, so if you drink a ton of potassium or salt alternatives, then that is going to obviously increase it and cause some problems, which we'll look at in a second here. Okay, make sense? Hope so. Okay, so we can get rid of the potassium from inside of our cells. How do we do that? Well, trauma, of course, is always an issue. Kidney, whatever. Acidosis. Okay, so now too much potassium in our bloodstream, too little potassium in our bloodstream. Again, we'll look at both of these things when we talk about especially diabetic ketoacidosis that's big time has to do with potassium on that, okay? And of course, insulin deficiency, it goes ahead and insulin actually kicks potassium into the intracellular fluid. Alrighty, so if you don't have enough of it, you're going to have it outside, and therefore in the too much of it outside the cell. Okay. Decreased renal excretion of potassium. Okay. Fine. Renal failure. There's something called Addison's disease we can look at later on. Potassium-sparing diuretics. Yes, we have diuretics that specifically will keep the potassium inside of your body. So if you're an overdosing on potassium-sparing diuretic so you can make your weight in wrestling, then that's a good way to get too much potassium in your blood, which is kind of sad because if you're doing it for wrestling, now you're weak because of this whole action potential thing, and you might even be paralyzed, so you're definitely going to lose your match. And it would be bad to have arrhythmias or your widen. It's totally opposite here. When you get too much potassium, you get the whole widened QRS section here. That gets really wide, so it slows everything down, and then really peaks your T wave way up. So again, potassium-sparing diuretic is probably not the best thing to do if you need to make your weight for wrestling, because you're not going to win anyway. And there is the EKGs. Look just like my pictures. Of course, mine are better, but that's life. Not everybody can be an awesome artist like myself. Okay. Let us move on to calcium. Okay. Calcium is all over the place. Okay. Hopefully, you came out of your prerequisite classes knowing that calcium is everywhere and involved in everything. So when you have messed up calcium concentrations, you see that all over the body in many, many places. I'm really not going into it too much right now, okay, just because it is all over the place. All right, so how do we get hypercalcemia? Well, hypercalcemia we are getting primarily from too much PTH, or parathyroid hormone. Okay, parathyroid hormone will increase your calcium levels in your blood, or your excess serum levels of vitamin D. So you're getting way too much vitamin D in your serum, which will also pull that calcium right out of your bones and stick it back in your blood because you have way too much vitamin D running around. Okay, yeah, that can happen. Okay, hypocalcemia. Not getting enough calcium, opposite of this, right? Insufficiency of parathyroid and vitamin D. You get too much deposited in your bone, then you're not going to have a bunch of calcium. Again, we're talking about anemia, about in your blood, right? Too much in your blood, okay? Not going to have enough there. Maybe you're not absorbing it in your intestine, okay? Or you're not intaking enough of it. Again, this is a whole sore spot between allopathic physicians and naturalistic physicians, okay? Because a lot of people cannot absorb calcium after a certain age. What that age is highly debatable, but there you have it, okay? Phosphate, also very, very big in your body. It has a lot to do with acid-base balances and cellular energy as in ATP levels. Okay, so your phosphate, you'll see all sorts of things ending in phosphate throughout your entire body. These are very, very important. So it's a very, very important. Hyperphosphatemia, too much phosphate in your blood. Most MCC, you'll see this a lot by the way, most common cause is renal failure, is one of the big ones. Again, your kidney fails, you lose everything, including phosphate. Okay, chemotherapy and hypoparathyroidism. Okay, your parathyroids are directly involved with the phosphate. So if you don't have your parathyroid is working correctly, then you're going to get too much phosphate because they're supposed to keep it down. Okay. Increases in phosphate cause decreases in serum calcium levels. Okay, so that's the one that goes opposite of the calcium. And so what you see most of the time is symptoms that related to the hypokalemia. Okay, that's all that's saying. All right, so let's look at this one over here. Hypophosphatemia. Okay, inadequate absorption or deficiencies in vitamin D, or again, most commonly, increased renal excretion and associated with hyperparathyroidism, the opposite. Okay. Signs and symptoms: decrease in energy. You don't have enough phosphate. You're going to run out of energy because, again, ATP, adenosine triphosphate, makes sense. Decreased oxygen carrying capacity of red blood cells. You're going to have problems with leukocyte and platelets and neuromuscular dysfunction. Again, for a variety of reasons, this has a lot to do with all of that system. Okay. All right, let's look at magnesium. Magnesium, big cofactor. You see, a cofactor is something that you need in biochemical reactions. It's like the extra thing you need. Okay, so magnesium is all over the place as a cofactor in these intracellular enzymatic reactions. Okay, neuromuscular and smooth muscle function, also a cofactor. You need magnesium in all of these things to help out. Okay, so how do you get too much of it? Well, renal failure, so you're not getting rid of it, or adrenal insufficiency, is in your adrenal gland is not working correctly, and therefore you're going to have too much magnesium in your blood. Okay, not even going to get into that right now. Okay, again, cofactor, so you're going to have all sorts of places. The neuromuscular, cardiac, and respiratory systems are all going to be involved when you have too much magnesium in your system. Okay, as opposed to if you don't have enough, then usually you're just stuck with neuromuscular issues. Is usually how it manifests itself because it's pretty apparent. Okay. Why would you not have enough magnesium? Usually it's because you're malnutritioned or you're not absorbing it. Again, it's a cofactor. It's not one of your major things that you tend to think about very often. Okay? Okay. Acid-base balance. I'm going to go ahead and stop right here, and we'll put acid-base balance on a separate video.